feel empty, and besides, I'm really tired.
Anna, you haven't attended class in 2 weeks. I'm really worried about you.
Stop making me feel guilty.
I'm sorry.
Besides, I'm just gonna get a 60 in the course anyways.
That was one test. You're such a brilliant person.
Just go to class. I'll review your notes.
Alright, but tonight we're going out for dinner. No more of this, I'm not hungry. And then we're gonna go to Rye's party later.
Okay.
She seems a lot happier today.
Yeah,
I mean, cheer up. At least she's not depressed.
I guess. Hey girl.
Hey, do you like my outfit? I maxed out my credit card.
You what?
I maxed out my credit card. I'm loosening up. Do you guys want to go smoke?
Anna, this isn't like you.
Stop being overly dramatic. I'm taking some risks.
Anna, I think we should go home.
Leave me alone. You're literally killing my vibe.
Anna, why are you scratching?
There's bugs on my skin. Can't you see them?
There's no
There's bugs on my skin.
I'm going
There's
to get
bugs.
an array.
Hi, what's going on?
I don't know, she just won't stop itching.
Alright, that's okay. I'm here to help, okay? I'm just gonna get her pulse right now. And you said that she experienced some depressive symptoms before?
Yeah.
Okay. Alright, so seeing as she's had depressive symptoms and now manic symptoms, CERT doesn't have the diagnostic equipment to diagnose her, so I'm just gonna call EMS, okay?
Okay.
Alright, campus please. Hi Anna, I'm Dr. Jones. I'm gonna be the doctor taking care of you while you're here.
Hi.
Okay, do you know why you're here, Anna?
I guess I went a little overboard at that party.
From what it sounds like from your friends and family, it sounds like this is different. This is a different state than your normal mood and behavior.
Yeah, I'd say I feel depressed most days.
How long would you say you've been feeling depressed?
I mean, the last couple weeks I've been feeling really down. Sometimes it's hard to even get out of bed.
Anna, has anyone in your family been diagnosed with bipolar disorder?
Not that I'm aware of, but what would that have to do with me?
Well, it sounds as though you're experiencing the beginning of a manic phase, a phase that is characteristic of having elevated moods that last at least a week. And in patients with bipolar disorder, the manic phase is accompanied with a depressive phase which affects daily activities and lasts for at least 2 weeks.
The depressive part does sound like me, but I don't think I've ever experienced a manic phase before tonight.
Yeah, see, most patients who experience mania or hypomania, which is a milder form of mania, they don't tend to report these symptoms because they don't see the increased energy as a negative thing.
Well, how do you know I have this disorder then?
Bipolar disorder is a complex disorder, and when we see patients exhibiting all these symptoms, we need to rule out any other possibility.
And what else could it be?
Unfortunately, bipolar disorder has a high comorbidity with ADHD, panic disorder, personality disorder, and OCD. And as well, we need to rule out non-psychiatric contributors such as brain tumor and thyroid condition, and we'd have to conduct a blood test and a brain scan to rule out the latter.
And what happens if you don't find any of these things?
Then we'd have to consult a psychiatrist who is well versed at diagnosing and treating bipolar disorder.
And they'd be able to tell me what's going on?
You know what, with lab work, collateral from your friends and family, the psychiatrist, and with other modes of evaluation such as the mood disorder questionnaire, we should be able to give you an answer, yeah.
Okay, I just want to figure out what's going on.
Great, I understand. I just had to recently diagnose my patient Anna with bipolar disorder.
No.
Yeah, I can only imagine what's going through her head right now.
Does it happen to run in the family? Research has actually shown that it's a genetic component, so if one parent has it, it's 15 to 30% more likely that an actual child of the parent would have it.
Yeah, very true. However, not in her case, because I've gone through her family history, but it seems as though she's been exposed to environmental triggers,
Mm-hmm.
Being a first-year student, having to adjust to this new lifestyle, and having trouble sleeping. All these symptoms worsen the manic phase in bipolar disorder patients.
Any drug or alcohol abuse?
No, but I think she might have gone down that path.
Yeah, well, I mean, it's good we started her on medication now. We can treat the biochemical basis for it, and hopefully the psychiatric care can kick in, and she'll actually start getting better.
Bipolar disorder is a very complex condition with symptoms varying extensively within individuals, so it shouldn't come as a surprise that many neurotransmitter systems play a role in its overall effects. 3 especially important neurotransmitters, which are all part of a class called monoamines, are dopamine, norepinephrine, and serotonin. Dopamine activity is affected in patients with bipolar disorder due to abnormal activity at the dopamine transporter. Less availability of dopamine transporters can result in less dopamine transmission and a depressed state, since dopamine is an excitatory neurotransmitter. Conversely, there is also an increase in synaptic dopamine due to the dysfunctional transporters, which can result in a manic state. Bipolar patients also appear to be hypersensitive to changes in levels of norepinephrine. While patients in a depressed state have reduced levels, patients in a manic state have increased norepinephrine turnover, as has been demonstrated by taking samples of cerebrospinal fluid from manic individuals. The results of studies conducted to determine how serotonin activity differs in patients with bipolar disorder have been less consistent. However, one correlation shows that decreased serotonin levels are associated with mania and the aggressive and impulsive behaviors with which a manic state are often accompanied. Anatomically, bipolar disorder has also been associated with prefrontal cortex and limbic system dysfunction, as well as reduced volume of the hippocampus. Bipolar type 1 patients present with severe manic symptoms lasting 7 days and an episode of depression lasting 2 weeks. These episodes may be rapid cycling. This is 4 or more episodes within a year. Bipolar type 2 is defined as a pattern of depressive episodes and hypomanic episodes, but no full-blown manic or mixed episodes. This type of bipolar disorder is more common in women. Bipolar disorder not otherwise specified is diagnosed when symptoms exist but do not meet diagnostic criteria for either bipolar 1 or 2, but symptoms are clearly out of normal range of behavior. Cyclothymic disorder is a chronic state of cycling between hypomanic and depressive episodes that do not reach the diagnostic standard for bipolar disorder.
I'm here to discuss some treatment options with you.
Okay.
Yeah, so the treatment plan I have recommended right now is a combination of at least one mood stabilizing drug and psychotherapy.
Mood stabilizing drugs?
Yeah, so the mood stabilizing drug that is most common for patients like you is lithium carbonate. Basically, this drug helps to stabilize mood, reduce manic episodes, and prevent depression.
And why would I need the psychotherapy if I'm taking the mood stabilizing drugs?
Psychotherapy is important for you to be able to understand and cope with your depression, cope with your disorder.
Shouldn't I be taking antidepressants if I'm depressed?
Okay, well, the problem with antidepressants is they might actually trigger your switch back to the manic state. So, yeah, if we need to consider that, we'll talk about it at our next appointment.
Okay. Are there any non-drug treatments available?
Yes, there are electroconvulsive therapy as well as cranial stimulation. But these treatments are for patients who have really severe forms of the disorder, and as well they're not responding to medication, so we don't need to worry about that right now. Okay.
Okay. What are some things I can do at home to help with my disorder?
Yeah, so you can exercise regularly, eat healthy, sleep well, some meditation, massage therapy, all these help, as well. Just remember, don't take alcohol or drugs, because these may actually promote risk-taking behavior as well as increase your risk of depression, okay?
And what would happen if I chose not to start treatment?
It's very, very important that you start treatment as soon as possible, because young adults and teenagers actually, if you don't start early, it promotes more severe symptoms as you grow older.
Okay, thank you for your treatment recommendations. I think I'm going to get started with
Very
them.
good. All right.
Morning, Anna.
Morning.
So tell me, how have the past couple weeks been since we last met?
All right, the medications I've been taking have definitely been helping, and I've been following all the breathing exercises, so they've been a lot better.
That's wonderful news. I'm glad to hear that you're not letting your symptoms control your day. How is school this semester for you?
It's busy. Sometimes I get a little flustered when I have a lot of assignments, and it's at these times I find I'll go into my depressive state.
Okay. Well, it's normal to have these changes between depressive and manic phases. This change is actually called typical bipolar cycles. Majority of the times, depressive phases outnumber the manic phases.
Oh, I didn't know there was a name for what I was experiencing. But is there anything that I can do to stop myself from feeling so flustered?
Well, us clinicians, we like to put names to various concepts. Just keep in mind that it's okay when you go into these phases, but at the same time, make sure you reach out to anyone, if not myself or your friends or family, if you do feel that you are spiraling.
Okay, I will for sure. I just find that each time I go into my depressive phase, I can't come out. I just lie in my bed and think, why is this happening to me?
It must be tough during those times. Have you spoken to your academic counselor then in regards to reducing your course load to help alleviate these feelings?
No, I want to be a full-time student and finish school on time.
Is there a particular reason why finishing on time is important to you?
For me, it means that I haven't let bipolar disorder take over my life.
Okay. Have you found that your marks have then improved or declined since starting the medication as well as beginning the counseling sessions?
They've been improving, and that's why I know that I can do this.
Anything else you'd like to add before we finish our session for today?
Nope. Actually, yes. I just wanted to say that the therapy and the medication have definitely been helping me control my emotional state, so thank you for that.
I'm glad to hear that. Well, enjoy the rest of your day then, Anna, and I look forward to seeing you again next week.
See you then.
Perfect.
Currently, there is no cure for bipolar disorder, but with the right treatment, most people with bipolar disorder can live normal, productive lives. Supplementing treatment, family counseling, and individual therapy sessions is helpful. And although being diagnosed with bipolar disorder can cause great hardship, these coping skills and support groups can allow one to face life's challenges head on.